to live a healthy life.
Yeah. Where does she get her information from? Do you watch TV with her?
And you're not wearing a mask at home. All of these things that we find in African Americans increase your susceptibility to getting the virus, especially this more contagious Delta virus. Right now, in hospitals throughout the country, but most certainly in the South.
What happens if it's positive? You do not want to take the risk.
You need to ask those questions.
What made you come?
I came because I want to get vaccinated so me and my family won't have COVID.
Hi, this is Dr. Lenore Coleman coming to you today on For Your Health. I'm here in our studio in Atlanta, and as you know, on Saturdays we do our Sugar Busters from 11 to 12, and then around 1 o'clock or so, I usually, if I'm blessed enough to have a guest, for us to have a COVID conversation. Right now, all I care about is COVID. I'm all about COVID-19, trying to decrease the number of African Americans and people of color in this country who are dying needlessly of COVID-19 because they refuse to get a vaccination. So I heard something interesting this morning because I'm really trying to keep my finger on the pulse. So I like to try to bring updates every Saturday of things that I learned that I didn't know. Now, number one, I learned that 55% of the African Americans in this country live in the South. I knew it was a lot, but I didn't know it was 55%, number one. Number two, as you are very aware, COVID-19 is raging throughout these southern states, Mississippi, Alabama, Georgia, Florida, even though it is considered a southern state as well, Louisiana, Tennessee. These states are not doing well. And because the African Americans that live in those states are not getting the vaccination. I also learned today that 120,000 children have lost their parent or parents since this epidemic has started. 120,000 kids are now, some of them are orphans because both their mom and dad got sick and died from COVID-19. All right, so kids are back in school. Kids, especially the younger ones, are having COVID infections and they're not sick. You don't know that they're sick. And they're bringing those COVID viruses into your home and giving it to you. I know that is for a fact because one of my colleagues and she's a film producer, just got over being sick for 2 to 3 weeks with COVID that she got from her 9-year-old, and he was fine, no symptoms. He got the COVID from, they think, his grandmother, but maybe his grandmother got it from him. Anyway, the grandmother's not vaccinated and neither is my colleague. And so we had a real frank discussion about why she didn't want to get vaccinated. She had all sorts of reasons, none of which made any sense to me. Because she just got over being sick with COVID and she's still suffering from the symptoms of shortness of breath and fatigue that seem to linger after you're over the infection. So she just doesn't have the stamina that she used to have, and it's probably going to take her months to get back to where she was. So this is something that we have to focus on, folks. African Americans, when you look at who died last year and who are dying right now in hospitals, are people who have diabetes, hypertension, obesity, COPD, asthma, lupus, cancer, all the HIV/AIDS, anything and everything that decreases your immune system. So right now there's no discussion in my mind of do I get vaccinated or not. The answer to that question is yes, you should. And if you have a question or you're still doing your research, then you need to call me so I can tell you what I know from my research that'll tell you that you need to go out today, walk in someplace and get vaccinated. This is a must because I am sick of black folks dying before their time. It doesn't make any sense. So today, I decided, okay, so since I'm a Christian, I love the Lord, I was going to bring somebody on the show who loves the Lord and is a Christian. And this is Joe Smith. Hey.
Hello.
Thank you.
How are you?
I'm good. Welcome. Woo. Okay, so what I'm going to do is I'm going to have you introduce yourself, because I needed to have this audience hear about you and what you do every day, because there's folks, that don't believe that fat meat's greasy. Okay, they don't believe that people are actually dying of COVID. They believe that they're just making this crap up.
Absolutely.
So you actually work every day in locations where you can testify to this. So tell folks who you are and what you do, please.
All right. So, again, I'm just happy to be here. So thank you for inviting me. I really appreciate it. But my name is Joseph Smith III. I'm from Miami, Florida. I am a little bit of everything. I am a chaplain. Well, first of all, I'm a man of God. Let's make that clear. I'm a man of God. I am a chaplain. I'm a pastor, record label owner of Jehovah Jams Records, and I'm so happy to be here. So I know we're going to get into a lot today. So just a little bit of background about me. I went to undergrad at Purdue University in West Lafayette, Indiana. So I'm a Boilermaker. Go Boilermakers. And also, I got my master's degree at Mercer University here in Atlanta, Georgia, at the graduate level, so I praise God for that. I got my theology degree, and so I'm a licensed, pastor and everything. So,
I love it. I love it. So this is the kinds of guests that I'm having on this show, folks. People who are certified, qualified.
Yes.
Right? I'm not just kind of just walking down the street and saying, hey, you over there, come on over and get on for your health, okay?
Grabbing folks off the street.
I am not grabbing folks, no, okay? I ain't got nothing against them folks on the street, but I need people who have gone to school, and what they do every day, they continue to improve, but they have some initials and periods behind their name. I'm really into that. Some of you don't think you need that, and that's fine, but I am a person who's got initials and periods behind my name. I took the time and the sacrifice to go to school to get to where I'm at as a pharmacist and certified educated, and this man's got master's degrees, and he's got degrees in theology. So, and he actually is practicing your craft because you're a chaplain,
Yes.
right? And you said that you were a chaplain actually in environments where you're doing hospice.
Yes, correct.
Okay, can you tell folks what hospice is? Some people don't know what hospice is.
Okay, so hospice, to make it short and sweet, a lot of times people think it's an end of life situation, but it's not necessarily end of life. It's this care that people need that they may not be able to get it at home. They may not be able to get it in a hospital setting, and so it's something where it's just an extra level of care, whether it's from the medical side, whether it's from the spiritual side. We have social workers that work with hospice patients. It's a little bit of everything, and then you have sometimes the palliative side of it, where people are being made to be comfortable,
Right.
That type of thing. If it is an end-of-life situation, but sometimes people are in hospice care and they live for longer periods of time.
Yeah.
Not just that it's a death note where they might die in a couple of weeks or a month.
Yeah, and listen, folks. You know what? Like, we're Christians here, right? So you do understand that God's making them decisions. He's in control of this live or die. So I know as a pharmacist, if I've worked in hospitals, I've been doing this work for 40 years. I've seen people who were in hospice who weren't in hospice anymore because they're still here. Okay, I know people that have been told by their doctors that they got 4 months to live, and they're now counting 10 years, they're still here. So these are the decisions that you're working with families, right?
Absolutely.
Supporting them spiritually,
Yes.
right? Praying with them, helping them get through this difficult time, right?
Yes. And a lot of times, the misnomer, as somebody who's a chaplain, and this is something that I've discovered over the last couple of years of being a chaplain, a lot of times when people hear chaplain, they just think that someone, as a Christian, is trying to convert them to Christianity.
Right.
And that's not necessarily the case. The case is that in a hospital setting or in a hospice setting, a lot of times the nurse or the doctor don't have all day to sit in the room with them, or they need somebody else
Right.
that can be there, that can listen to them, that might be able to carry some information that they might not want to expose.
Right.
To a doctor or a nurse.
Right.
And that's what the chaplain does. So the chaplain is a support system. Now, if somebody is in a situation where they need God and they want to be in the realm of the God that I serve, which is Jesus Christ through our God, then that's what I'm there for.
Right.
If that's what they need.
Right.
But at many times, people just need support, whether they're atheists, whether they have no religion at all, whether if they're Jewish or whatever the situation. At that moment in time when somebody's going through a health crisis,
Right.
or going through possibly death, they need someone who can be supportive.
Exactly.
And that's who the chaplain is.
So now, during this last year, we're almost 2 years here. During this last, since I guess March of last year, any of those folks have COVID? Did any of that, or not much? Mostly cancer.
During the time when I was really going through everything as far as COVID, it was during my residency year.
Okay.
At a certain hospital, and as I was a resident there, it took us from a couple cases to the hospital being full of the cases, and how do we deal with this, because nobody knew. I mean, everybody's learning it all together, right?
Right.
And so the biggest thing to me is throughout this entire time that people still don't believe that it's real.
Yeah, they don't believe it's real.
Don't understand that people are dying.
People are dying.
They are dying left and right. My family, and we'll talk about that a little bit later as well. I have family members who suffer losses. I've had a niece and a nephew, both in hospitals and everything. So this is real.
It's real.
And so in the hospital, when I was there full time, we had cases of people. Okay, so a few people are starting to die, and then after a while, many people are starting to die, and then later on, you have full ICU units that are full with just COVID patients.
Right.
Okay, so for instance, I have one floor, where on this floor it is 20 rooms.
Right.
Out of the 20 rooms, 18 of them have COVID.
Wow.
And then out of the 18, you have 16 or 17 that are black.
Wow. Did you guys hear this? Okay, now you guys think that we're making this stuff up. Now, last week we had my 2 hospital pharmacists telling you what they're seeing in their COVID hospital. Now you have the chaplain here going through his residency and in a hospital environment, and this is who he's seeing with his eyes. This is not make-believe, people. Some of those folks were on ventilators, right?
Absolutely.
Okay, now when you're on a ventilator, were they talking to you? No, they're not. You're not talking on a ventilator, folks. These people are actually on their stomachs because they found that by putting people on the stomach, it actually makes it better for COVID. Their families are not allowed to come see them, are they, sir? No.
Okay, so during this time, and I'm going back to the beginning because I want to get a clear understanding for everybody to really feel my heart on this, right? Okay, so first of all, a lot of times with chaplains, you don't hear about the chaplains being a part of this situation.
No.
and being a worker who is there with the doctors, with the nurses, because again, we're not just there for the patients.
Right.
We're there for the patients, we're there for the families, we're there for the friends, but also we're there for the doctors and the nurses and the staff.
Right.
That are in the hospital.
They're in the hospital.
Or, with the hospice. Now, so a lot of times we think about, okay, the glamorous part of what the doctors and the nurses do. What about those who clean the rooms?
Right.
What about those who see the bodies go into the body bags and then they go to the morgue? Okay, we're not hearing about those types of people who are essential workers, right? Okay, so to get back to what I see or what I was seeing daily. Now it went from a couple patients to in certain hospitals, and I'm sure they have certain floors and that type of thing. But the hospital I was in, you had certain floors, and on these certain floors you had these patients that were intubated.
Yeah.
They were going through what they were going through. Families not being able to see. Now, this is what happens. So when a patient dies, the family members can't come in.
No.
Okay. So what they do is they take the nurse or the doctor. They take a tablet. They put the tablet inside the room, and maybe allow one parent or a patient's family member to come in. When they see them come in, they get a chance to watch their family members take their last breath over this tablet. That's how these people are watching their family members die. So you have all the other family members on a Zoom, they're on their phones and that type of thing, watching their family member die. Then you have the one person that's in the hospital that's there grieving with them. And then, as soon as they have a little bit of time with the family members, they take off their PPE and they have to immediately leave the hospital. Because you don't know if that person came in the hospital with COVID because they didn't get a chance to get tested or anything like that. So you can't have a bunch of people in the hospital during that time. So people, until somebody has this happen in their family or happen to a friend of theirs, then after that, oh, it's real.
Right.
But until then, it's like, okay, well, I don't believe it.
I don't believe it.
And so we've had several people. I've had several family members where a son or the daughter has, and this is I'm not making this up, where they've gone out to a party,
Right.
they've hung out, and then they've taken the COVID that they got back to the family.
Right.
Where both parents have been in the hospital, where one, like the father, I don't know, in one case the father died and the mother lived, and in the other case the mother lived and the father died. So I've seen it, I've heard it, I've spent time with the family members in all these different situations. And the thing is that when you go through this,
Right.
because I had COVID myself.
Okay.
Back in November of last year, I had it myself. And so I still feel some feelings of fatigue and that type of thing every once in a while. So when people say that they have these long haul experiences, these things are true as well.
Right.
Now, the thing that is amazing to me about the whole COVID thing, because again, we're still learning, still trying to figure out what's going on with it. To me, I tell people it's like shrapnel coming out of a gun.
Right.
Okay, so when shrapnel, from a military perspective, when shrapnel goes out of a gun, it hits different parts of the body or wherever it's going to go with different types of information.
Right.
Or different types of bullets or nails or whatever.
Right.
To me, COVID is like shrapnel going into your body.
Right.
Okay, every person that I talk to experiences something different.
Right.
So, in the hospital, we've had people who had heart attacks. In the hospital, we had people who had sickle cell where COVID has gone to their brain and they died from that. Okay. Then you have different people who say, well, my hair is falling out.
Right.
You have other people who are having problems with certain parts of their bodies or not being able to breathe. There was a gentleman in Florida whose tongue was enlarged that was out of his mouth because of COVID. How can this not be real?
Yeah, no, it's real. It's real. And the fact that you think it's not real, and so therefore you don't feel like you need to protect yourself. I have never seen this before. I have never seen, and I've been a healthcare professional for over 40 years. I've never seen in my career a situation where people don't believe healthcare professionals and people who work in the periphery of healthcare, right? So you're a chaplain, you're going in there, you're doing hospice care, you're helping families, you're seeing this with your own eyes. The news is showing refrigerator trucks to hold the black bags, the corpses, because the mortuaries in these small towns can't embalm people fast enough. And you don't believe that the trucks are there? I just don't understand it. Now, you said you had family members that won't take the vaccine. So how are they thinking about this?
I think, initially it's scary, just like anybody else.
Yeah.
In the beginning, we understand it because we don't know.
We don't know.
Again, it's something, if you're thinking about the Tuskegee experiment back in the day when it comes to black folk and different things that we've been operated on without medication and different. So I get that, I understand. But this is not something that's just happening in America. This is happening all over the world.
It's global.
So if it's happening all over the world and it's just not happening to black folks,
right,
it's happening to everybody. So if it's happening to everybody, we have to look at things a little bit different. Right? And so we have to say, okay, well, what's best for me? What's best for my family? And again, I'm not here trying to push vaccinations. All I'm trying to do is push information so people can understand, like, it's more than one way to look at the situation.
Right.
And so as we look at it, I say, now, on one hand, I had these people over here saying, like, look, man, I'm not doing it. I don't care what's going on. This is the situation because they're just trying to do this because they're trying to control the population on the earth. And then you have the other people on this other side saying, look, you're in the medical field, you're doing this, and your wife has this, so why aren't you getting, because it took a while. Now, I did know that eventually hospices and hospitals and the medical field would make it mandatory.
Yeah, no, that's coming. It's coming.
So for me personally, it took me a moment to realize that this is something I needed to do, but I decided to go ahead and do it.
Right.
For my health. Now, personally, when I'm out, I still wear a mask.
Right.
Because I'm like, okay, I'm still protecting myself and anybody else, just in case, if it's possible to get it again.
Right.
Even after being vaccinated.
Right. And because these variants keep changing,
yes.
The COVID of March 2020 is not necessarily the COVID virus of of where we are right now, September 2021. So this thing is mutated. It's called Delta. There's Lambda and Mu. All they're coming up with all these names. They're not really sure if those are more contagious or if they're going to be more what they call virulent, which means that they really attack you at a greater degree. That's what virulent means. So we don't know.
Right.
We don't know. So there have been people that they say, well, you know, vaccine doesn't keep me from getting the virus. You're right. It doesn't. Right? But that is not 100% true. Vaccinated people do have a lesser degree of being infected. That is true, but nothing is 100%. See, that's what they need to understand. So when you say, well, it doesn't stop me from getting the virus because people are still getting it and they've had the vaccine. Yes, but you said something really important. It's global. So when you look at Europe, you look at Asia, you look at Israel. The study that just came out of Israel is the largest study because they are one of the most vaccinated countries on the planet. And so there's now a study that's been published to give us some information about what this virus is all about and what does it look like in when you're looking at vaccination. And what it showed is those people that were vaccinated had a lower risk of infection. It showed that those people that were vaccinated almost completely did not go to the hospital. So it kept you from going to the hospital. It brought your hospitalization rate down to, less than 1%. It was low. And if you're not going to the hospital, what that means is you're not getting sick. You don't want to get sick. So you guys know about the flu. You get the flu, you get sick, but it does not take you to a hospital where you are now in an ICU on a ventilator. Folks, it's different. Don't tell me, well, it's just like the flu. No, it's not. You also said something really important. You still wear your mask. Because of the masking that occurred last year before vaccination happened, there was no flu. Do you know flu went away?
That's very true. I don't know, maybe one person that I know that.
Yeah, because we weren't spreading it. Viruses spread. They're in the air. You cough them out. You speak them out. You said something else interesting. You said they went out to your family, the younger folks, went to a bar.
Yes. Well, it was just some people that was in the hospital.
Yeah, that were in the hospital. They went to the bar and they brought it back to their family. The reason why bars are so hard is because most of them are indoors. Most of them don't have good ventilation. And just think about the last time you were at the bar, people have to talk loud because there's music playing. So therefore, you're basically shouting. Right? And so that aerosolizes the virus versus you're not talking, you're keeping your mouth shut. And you're not wearing a mask because you're drinking.
Right, that's right.
All right? So all of this stuff just makes common sense. This is just common sense. And so I want you to touch on this idea that I'm a Christian, I love the Lord, Jesus is going to protect me from getting the virus. So therefore, it shows that I have a lack of faith if I get this vaccine, because that means I should be trusting the Lord and not this man-made vaccine. What's your take on that?
Well, from a Christian perspective, I do believe that the Bible says to do things decently in order.
Right.
Okay. So if we do things decently in order, first of all, we're going to listen to the information, because God says, we should listen to those that are in charge and get information.
Right.
And then once you get the information, then you can decide for yourself, what you want to do. But I've heard several pastors say, it's okay, we're not going to worry about masks. And then they're going to allow people to come to the church. Because there are several churches that never close down.
Right, yeah.
The church I belong to, that I attend in Stone Mountain, my wife and I, hey Patricia, how you doing? Closed down for a period of months. And then when we did reopen, it was where, as soon as you walk into the door, they're tinted.
Right.
Here or here.
Right.
You have a mask. You have to wear a mask. Everybody's mask. Then you're in the seats, and so the usher will say, "No, you can't sit here. No, you can't sit there. You got to sit over there." So they're trying to put families together, but there's things in the seats that says you can't sit here. So it's social distancing.
Right.
So I believe that so many people are being led astray. They're being led to the slaughter by not following these pastors, by following pastors who are not saying the right stuff.
Right.
Who are not teaching the right information. The right information is to to make sure that we are being conscious
Right.
in every way possible.
Yes.
And not just saying we can come in because we know that God is going to help us, and we know that God is there for us because God is our Ezra, which is EZER. He's our help. He's a present help. We understand that. But at the same time, God wants us to be smart.
Right, he does.
Right? And he wants us to be vigilant on what we're doing.
Right.
And he wants us to make sure that we're being safe as possible.
Yes.
You know, God is not going to say, well, I want you to go out and stand in the middle of the highway knowing that the traffic on 285 or 75 is crazy. He's not going to tell you to do that.
No, he's not.
So if he's not going to tell you to do that, he's not going to sit up here and say, well, go to church and be around all these people and not wear masks.
No.
Or the same thing as in a funeral.
Right.
With a bunch of people, if somebody dies, we understand that you want to, be there and celebrate the life of the person that may have died. But that's why they're not having funerals right now. Because people are getting cremated, so you don't have to have a bunch of people that's getting sick and passing this on.
Pass that on.
So I created a song. I'm an artist as well with Jehovah Jams Records, and so I have a song that I did called "So I Can Live." And in the song it says, I say, "Lady, look, give me 6 feet because I want to live.
Right.
Man, give me 6 feet because I want to live." And so I did it, letting people know that, hey, look, we have to be careful.
Yeah, we do.
We have to have a sense of responsibility, not just for ourselves, but for each other. And I think to me that's one of the reasons why a lot of people aren't doing. They're being selfish about not wearing the mask.
That's right.
And then to me the biggest problem is that you have so many Christians that saying that they're not going to wear masks, not just black or not just white. I mean, just a lot of people.
Yeah.
Racist.
Yeah.
Just saying, look, I'm just going to do things the way I want to, and that's not what God is calling.
No, he doesn't want you to do what things because you want to.
Right.
Where is that in the Bible?
Right, and because it says first, it said before anything, we have to love our neighbor.
Right.
So to me, loving our neighbor is being able to do what we can for the greater good of taking care of each other. And if we're doing that, then that's when, okay, look, we understand people want to be able to go out. They want to go party. They want to be able to go to work. And people don't want to lose money and that type of thing. But at the same time, it's like, if we have to be safe like this for 2 years, then we have to do what we have to do.
Yeah, so this first is you're supposed to love the Lord with all your heart. And the second is like unto this, you're supposed to love your neighbor. That's what it says. So infecting your neighbor, infecting your kids, your family is not biblical. Luke was a physician. He was one of the 12. If Jesus didn't think he needed to have his own private doctor on the case, he wouldn't have picked Luke. He could have picked anybody. Okay, he picked Luke. Okay? So there's if you just look through the Bible, listen, I'm sorry. It is the devil that is here to kill and to steal and to destroy. That is not Jesus. He is here so that you can have life and have it abundantly. I don't know what Bible y'all reading. Y'all not reading the same Bible I'm reading. This is, I want to stop the death and the dying in our community. It is critical. It is not biblical. It is not blessed by the Father. And you need to be doing whatever you can to stay here. Just think about how many of our grandparents and great aunts and great uncles we lost last year.
Absolutely.
Those elderly folks, many of them in your families, you lost them. They were Christian. You remember being a kid, and what did they do? They made you go to church. Oh yeah, no. If you're gonna be in my house, you gonna go to church on Sunday. Okay, there was no discussion with my mama. Okay, if you were gonna live in her house. Okay, you can live wherever you want to live, but in this house.
Right, that's right.
Okay, we doing what the Lord says we're supposed to do. This thing is biblical. I mean, for no other reason you should be protecting yourself. And one of the best ways scientifically is to, do the vaccination. And listen, people say, I'm afraid to take the shot. Well, I'm sorry, aren't you not supposed to have a spirit of fear?
That's right. And power and sound mind. Power and a sound mind. Now,
power and a sound mind.
So, I remember when we were little, when we were in school, we used to get the vaccination. We used to get those every year. I remember that. And also, the apostle, the founder of our church, he made a comment one Sunday. He said, it's funny how so many people in their life, they eat whatever food they want to eat. They drink whatever they want to drink. They do sexual things that they shouldn't be doing, or whatever. All these different things that they're doing, but they're worried about taking a shot.
Yeah.
So so if we're worried about all these other things that we're doing and we're having fun with this and all that type of stuff, but then you won't take something in your body that may save your life.
Yeah, I don't get it. So that's my thing. So this is my thing. And this may sound harsh to y'all, and I'm sorry. I'm going to apologize up front, but this is my thing. I think you need to walk on one side of the street or the other. You're either walking on the right side of the street or you're walking on the left side of the street. So this is it. So you say you don't want to take the vaccination. You don't want to protect yourself, right? And you feel that your immune system is great and that you didn't get sick last year, and so you don't see what the problem is, okay? And that's your stance. You don't believe in vaccinations, you're not going to do it. All right, so cool. All right, so when you get sick, though, now you can't come in and take up the hospital bed of the person who took the vaccine who now has had the heart attack, or now just found out they have cancer and need to go for surgery now to get the cancer out while it's still small, right? Or come in for the various other kinds of treatment. You can't take up a bed, see? So you need to stay on this right side, on this left side of the street. You can't cross the street now and then talk about, oh, medicine, please give me some monoclonal antibodies, so, infusion, so I can get better. Because you just told me you didn't want to take this vaccine because you don't believe in medicine and you don't believe in science. So then when you get sick, you can't all of a sudden come over here and say, give me the best treatments you got.
And
for me.
jump ahead of everybody else.
Yeah. I just don't think that's fair. I don't think that's fair because it's not an unlimited amount of hospitals. These hospitals are suffering. You know.
Absolutely. Every day.
You said when we started that you came in and during that residency time when you were there at the hospital and you started off with 2 patients and then you ended up and then they had to convert whole floors for COVID.
Absolutely.
You saw that happen.
Yes.
So it's not like we're telling you that this is not happening. This stuff is real.
Right. And now even as a chaplain for a hospice, there are locations where you have the senior citizens facilities where entire facilities have had to close down.
Yes.
And so they closed in the middle of COVID and then reopened.
Right.
But then many of them end up over the last couple months have had to reclose, not allowing family members to go in again. So you're there when, so one person, staff member gets sick.
Right.
Okay, then pass it along to the patients, and they pass it along to those who live there, and they pass it on to the other staff. So you have to close the entire place down. And then you're there, so me as a chaplain, when that happens, what happens? I can't go see my patients.
No.
I can't see them. And a lot of them, some of them 70, 80, 90 years old, they can't, talk on the phone and that type of thing. And a lot of times family members, they'll wonder what's going on, and they can't see them either. So now we have this situation where you have all of these family members who are struggling because they can't see. They're stressed out because they can't see.
Right.
They're all these different things. And you have these families, these people that are patients who is bad enough for them to be in a place like that by themselves. And now their family members can't see them for a period of time because people, again, are getting sick.
Right.
They're not wearing masks.
Not wearing
They're
masks.
not trying to protect themselves. They're going out to these parties. They're going to South Beach and hanging out. They're going to these parties and they're doing all these different things. Or even house parties. If you have a house party and there's 20, 30 people and everybody's all bunched in together, that's still not safe.
No, it's not safe.
Right. So a couple weeks ago, I had a family member, a cousin on my wife's side of the family, who they unfortunately they went took a vacation. Because again, we've been on lockdown for over a year, people. So yeah, people want to go out and have a good time, and they want to have a vacation, that type of thing. So they weren't vaccinated, unfortunately, and then they came back, and when they came back, both of them were sick. A week later, she got better. He didn't. He has a heart attack, goes to the hospital, on a ventilator. A week later, he dies.
Wow.
He's only 51 years old. And so, I have a cousin, unfortunately, her mother passed away. So, I mean, it's just, I have a nephew, like I said, in Miami. He was in the hospital for a couple of weeks. I had a niece in Indianapolis. She was in the hospital. So I've seen it on both sides of my family. Right. Where people have, and again, they're not necessarily living their lives recklessly. No. That's not necessarily the case because there are a lot of people that are out there that are living reckless. But this want to live life, but at the same time, we still have to we have to get as much education as we can.
Yes.
We have to be careful. But at the same time, sometimes we just have to say, no, I can't. Certain things I just can't do right now.
Right now, exactly. And see, the thing that just breaks my heart, for me personally, is if you understand the science of viruses and you understand how this viral infection stuff actually works, what happens is these viruses, they want to live. And so in order for them to live, they have to mutate. So now we got this vaccine on board. So now this virus is coming into your body and learning your immune system and learning how to get around your immune system. So that way when you transmit it out to the next person, it's better able to kill you. Okay, this is the way viruses work. So if everybody tomorrow in the United States of America went out and got vaccinated, then because of that, got the 2 shots, right, for those two vaccines, and then the 1 shot for Johnson & Johnson, and everybody got their immune systems boosted, it would shut this virus down. See, the virus couldn't replicate. Viruses have to replicate, and your immune system stops that. So if everyone could boost their immune system with the vaccination, it would shut this virus down so it couldn't learn, and it couldn't replicate, and it couldn't mutate. And then we'd be back to normal. We could do this. But it takes everyone getting it so that their immune systems can be taught to attack this virus that's out there now. So the fact that we're messing around here, and but we're still at, in some places, I'm in Clayton County, we're at 38% vaccinated, fully we need to be at 80%, folks. So I need, in the next 4 to 6 weeks, I need everybody where I live and pray and play to get up to 80%.
Absolutely.
So that Coleman doesn't have to wear a mask, and I can feel safe, and I can get back to normality.
Right. Absolutely, absolutely. I was just looking at my phone because somebody sent me a text. They had a question.
Oh, good.
And so again, anybody who's watching live, that's on the Jehovah's Jams page, or that's on my own Facebook page at Joseph Smith. If y'all have some questions, the doctor is here. She'll answer any questions that you like. So please, just hit up. I even shout if you want me to shout you out, and then we'll get a question. But the question was, somebody asked about the real origin of what happened with this. Do you have any ideas of where the origin came from?
Okay, so I still think that we don't know. I don't think anybody knows for 100%. We do know that it happened in China. We do know that during that time back in November, December, October of 2019, right before 2020, that this stuff was being spread. There are some people that said that this has been engineered in a lab, and that this was part of this whole chemical warfare thing, and that this thing was all a major conspiracy and plot. Okay. I'm not a virologist, but I have spoken to some people who are researchers who that's what they do, is virology. And they said that based upon what they know, which is everything about viruses, that this was not a virus that was made in a lab. Now, the initial story is that it came from a wet market in China where they eat sort of exotic stuff like snakes and reptiles and that kind of stuff, and that it wasn't very clean, it wasn't very cautious. They also had the bats. This is a virus, this coronavirus is a virus that usually is seen in animals. It is not usually seen in people. So they thought that there was maybe some cross-contamination that happened in this particular these wet markets in this Hunan province where these things were, and that was the origin. I have not had anyone, and I listen to this stuff daily. No one has really said the exact answer. So the answer to that question is we don't know. I don't know. I do not believe, though, that it was chemically engineered. I do not believe that. And the reason I don't believe that is because when you do chemical warfare, you're trying to attack a population of people. This is something that is very pinpoint and targeted, sort of like a drone strike, So if this was chemically engineered in China to attack the West, let's say, they were trying to kill us here in the United States with this thing, well, I don't think that they would have had that many of their own people die. Because we don't even know. We know a whole bunch of their people died, but I don't think we know how many of their people died, because I don't think they wanted us to know that. Okay, but I do know this, that when that thing started happening in China, they shut that bad boy down.
Right, that's right.
Everybody had to stay home. The doctors couldn't even go home. Every doctor in them hospitals in China had to stay in a hotel next to the hospital. So they commandeered the hotels in the area. And so those doctors could not go home and see their family. Okay, whereas here in the United States, we let our doctors go home.
Right.
Okay, but that's not what they did. A whole lot of seriously radical things. So they shut that virus down in China once they saw that that thing was spreading like it was spreading. So it's not a super good answer to your question. I don't know exactly where it came from, but I do know that back in January and February of last year, we knew, we meaning the government, our government here, knew that this thing was contagious, and they knew that this virus was deadly. And the administration last year did not do what they needed to do and tell us the truth so that we could shut this thing down. And so a lot of folks are really upset because they feel like they can't really trust the CDC or the FDA or Human Services because they were telling us all that crazy stuff that didn't make no sense last year, right?
Right, that's right.
But this is a new administration, this is a new day, and I think that what I'm hearing in terms of what is being said by the government, by the FDA, by the CDC, by HHS, are coming from pretty trusted people who know what they're talking about. So I'm feeling pretty comfortable about what the information now.
Okay.
Yeah.
Amen. Well, again, there's so much that's going on, and I just think like from a health perspective, we don't understand. We might never understand, but at the same time, it's here.
It's here.
And it's how we go forward from here. And to me, the community process of it is when you're doing events like this, or even when you came out to the whiteout that we had on the lawn at New Creation Christian Fellowship in Stone Mountain, and you presented and you talked about vaccinations, and I think that if we have more of this going on and have more of this information to access, because so many of us all the time as black folk, we always say that we don't have access.
Right.
We don't have this information. We don't have access to money. We don't have access. We have access to something that can keep us alive.
Right.
And where we may not die before our time. Because I do believe that we have a set amount of years on this earth.
Yes.
But I do believe that there are times that can be prolonged. But then at the same time, I do believe that we can lose years if we don't follow certain rules and guidelines.
That's right.
So we can say that God is going to bless us and that He's going to keep us here for 100 years. But if we go out and continue drinking and we get hit by a car or we have an accident, then of course we'll die sooner.
Right.
It's the same thing I believe with COVID and what's going on right now. If we don't take steps to do this, then there's a possibility that we could not live as long as we think that we should live.
Exactly.
And so a lot of times, even with churches, because there was a church I think in Florida that stayed open and like 10 members of the church died because they weren't following safety protocols. And we have to do these. We have to be smart about it.
Yes.
And if we're not smart about it, then what we're going to end up doing is we're going to be losing people, like you said, not just older people, because now, if in the beginning it was like, well, we got to take care of the seniors, the 70-year-olds, the 80-year-olds, the 90-year-olds, and then there's a young man that was at a hospital. He was 31 years old. He died. Dr. Fauci said that he had, I think it's his girlfriend's or his daughter's boyfriend that died, and he was an avid runner, and
Right.
he died. He was a young man, and now you have children that are dying.
Yes, there's children dying.
There's a gorilla at the zoo. There's some gorillas at the zoo right now with COVID in the Atlanta Zoo. So if the animals, if they can get COVID, we can get COVID too. So it's not a game. It's not something that's fun. Again, last year in the end of November, I personally had it myself. I had to be out for work and missing my job. And I even I have a friend of mine who was he had it.
Yeah.
And he was in the same hospital that his mother was in.
Right.
When both of them in the same hospital. He unfortunately, he lived, but unfortunately his mother passed away.
Right.
In the same hospital, rooms down from each other in the ICU. So this stuff has to be real. It has to be real. And then there's a way for us to look at it through these vaccinations. All we have to do is take the information that we have and then go ahead and get the shot.
Yep. I was speaking to an allergist, and actually I'm going to have her on the show. I was talking to her 2 days ago because I wanted to, she called me back. I had reached out to her on LinkedIn, and she called me and said, hey, I'd love to be on your show. And I asked her, I said, listen, you do allergies. A lot of people don't want to take this vaccination because they say they have allergies. And then she said to me, she said, listen, Doc, a lot of people say they have allergies and they don't even know that they don't have allergies. They come. I have people coming to my office all the time and they say I have allergies, and I say describe what happened to you, and they say, oh well, I broke out in a rash, or oh well, my stomach started hurting, or oh well, I started losing my hair, and so I think I'm allergic to this. And those are not allergic symptoms, right? A rash potentially could be an allergic system, but it might be just because you changed your soap or your detergent, or you've eaten something, your food that now makes you allergic. You hear of people who have peanut allergies.
Right, that's right.
Now that's one of the ones that I think, when I think of allergies, that's the one, because if they are even around the peanuts, right, their throat starts to close up, they can't breathe, and they start swelling up, which is called angioedema. That's a true medical emergency allergy. All right. They've looked at all of the ingredients that are in the vaccination, all the fillers and binders and all the stuff that's in this vaccination, and she said to me, they actually she's here in Atlanta. In their research lab, they looked at all the various fillers and stuff that's in the vaccine, and they have not been able to replicate any allergic reactions from those ingredients. That's what she said. They're doing the actual trial. So I have to believe her when she says that, right? So she says that she also, it's not just here in the U.S. When you look at the billions of people that have taken this daggone vaccine, the allergy and allergic reactions are minimal, very, very small. So for you out there who have allergies, please, that's why they make you wait the 10 minutes. Mm-hmm. Because if you're going to have an allergic reaction to that shot, it's going to happen right then. Allergies don't, you go home and 4 days later, okay, it don't work like that. Not for drug allergies, right? So this is good. So thank you out there who had a question. Please, if there's any other folks that have questions, we would love to hear them, because we're trying to get out some real information out here. So we're streaming live on Facebook. We're on your Facebook. We're on my Facebook. If you think of a question that you have that you didn't answer, call my 800 number, people. 800-788-0941. We are physically here in this place, my new location here in Jonesboro, Georgia, 177 North Main Street. I just moved in. I'm really proud of my new spot, right? And so I'm here. We are here to help the community answer questions, because like I said, I really would like everybody that lives in Clayton County and Fayette County, because I live in Fayette, I work in Clayton. I need all y'all to go get vaccinated tomorrow, okay? Because I need you to tamp this virus down so it can't continue to replicate and mutate. Yeah? Any other questions that are coming through?
No, I had a question for myself personally. How honestly, because when I was thinking, so talking, not talking, but hearing Dr. Fauci talk, 6 months or so ago, originally he said, and a lot of people thought he was lying, saying that he thought this was going to go into 2022. What's your prediction? What do you think? How long this is going to go?
Okay, because this country has at least 25% of the people who live in the United States of America who are what they call anti-vaxxers. So they don't care. I talked to a couple of them a couple days ago, and they've had family members die. One of them had her husband die. Couldn't see him. They had to cremate him. And I said, so are you going to get the vaccine? And she said, no. Now, if you witness death and dying in front of you, and you still make the decision that I'm not going to do it, you can't move that 25%. So what we do with this show is I'm trying to get those folks on the fence, right? They're not that 25% that's an anti-vaxxer. Because we have so high a number, the other countries don't have that. Oh, Africa? Oh, them folks are begging for the vaccine. The Caribbean, where I work, these people are begging for the vaccine. We actually have enough here for us not to only get everybody here vaccinated, but to give booster shots. Joe Biden is not giving up that vaccine. He's going to give some of it away, but he's making sure that we have it. Because this 25% is so high, this thing's not going to go away. We need to get up to 80, 90% of the population taking the vaccine so we can just squash it. And we have to do it quickly. Otherwise, it continues to mutate and change. We're allowing this virus to learn. So because of it's going to learn in this 25% that refuses to take the vaccine. Because there's a bunch of people in that 25% that are young and healthy and have wonderful immune systems. And so that virus, and they're going to be asymptomatic, and they're not going to know that they have it. And they don't believe in the whole thing. They don't believe it's real, so they're not going to get tested. So they're just walking around. I call them human virus incubators. They're just walking around. They got COVID. They won't get tested. They're young and healthy and virulent, especially the guys out there, right? Especially the guys.
I love somebody.
And you guys are letting this thing learn from you. So it is going to always be there. Now, I'm praying, my prayer to Jesus every day is that they sometimes can change and become less virulent. They sometimes can change and become less contagious. So I'm praying for that. So that it'll still be here in 2022 and on, but it'll be more like the flu. Because the flu doesn't necessarily kill you. But COVID will be around. And if you are immune compromised, there will still be people dying of COVID because their immune systems don't work.
It's amazing, really, because I came to the show today to be interviewed by Dr. Coleman, but it seems like I'll turn it to asking her questions because I'm so again, medical field is not my field. I'm a spiritual person, and I praise God for being able to have that. But at the same time, I think that we have to talk to the people who know this stuff, and we have to get questions from them that know this stuff and get answers for them that know this stuff. Because if we don't, we're going to be in this cycle, a continuous cycle of nothingness, where we're not allowing ourselves to get better or have the room to get better. So I just have one more question for you, because I know that your time is valuable and that type of thing. But if you could really, on a larger scale, what would you do? Like how would you position yourself? Because I know that you have the space here and you have these different things that you want to do, and we talked about doing some other events coming up. What else would you do for the community to make sure that people are understanding that we need to get vaccinated?
So what I would love to do, and I think this is my bright idea. So almost every school district in this country got money from the CARES Act in January. Almost all of them did. Every state got money. They then passed it on to every county, and every county should have passed that money, some of that money on to every city. What I wanted us to do is focus on the kids. I would love to get every middle schooler and high schooler in this country to actually spend the next 30 days researching COVID. talking to their doctors, talking to their pediatricians, right? Doing research, writing papers, doing extra credit assignments. And I would like the school system to subsidize that. I would like the counties and cities in this country that got that money to actually incentivize people to get the shot. Now, a lot of people say, well, I shouldn't have to pay you to get healthy. It's not about that. You don't understand nothing about working 2 jobs, not necessarily having a car, having to get someplace on a bus. You don't know nothing about that, okay? A lot of people are struggling financially. They've lost their jobs, they're on Social Security, or they're on, state assistance. Public assistance. They don't have the wherewithal to get to where they need to be. And so we need to help and incentivize them to be able to do that. That little $50 gift card you give them, that's a big deal to them. That might buy groceries for a couple, 2-3 days. It buys some gas. So we need to take that money that is already out on the street, that is still in bank accounts. They haven't spent the money. Many of these states and counties and cities have not spent the money. We need to do a population-based approach to making sure that every barrier that's out there is eliminated, which means we need to have vaccination sites not only at hospitals and at clinics and at pharmacies, but every single nonprofit in that city. Like, I'm a nonprofit. I need to be able to get the financing that I need to stand up a vaccination site, stand up a COVID testing site. If I want to do that as a community service, I need to be able to have the funding to do that. Because I have to hire personnel, I have to get the vaccine. So we need to be able to do that. So that as you're driving down the street here, you see my little flag out there that says COVID testing, COVID vaccinations, come now. And because these decisions are spontaneous. They are. People make spontaneous decisions. And they would drive in right then and they go ahead and do it. You never know, right? It would be nice if every church would be able to do that every Sunday. They could get subsidies. They could then be able to get the linkages with the public health departments or whoever the people are in their community to be at church on Sunday or be at Wednesday night Bible study.
Or even open during the week.
Or open during the week. So what's the problem is I think there's still not enough vaccination and testing sites in a given community.
Yeah. That's my next question, because again, I'm here with Dr. Coleman. It's her show, but JS3 is here. I just happen to kind of take over a little bit now. I'm asking her questions and everything because I'm so excited about what she's doing, and I'm fascinated because from a medical standpoint, there's so many of us that don't know, and again, the access is here, but we just don't have access. And so when you're talking about, what you were just mentioning, I look at it from another standpoint of those rural areas who may not have a lot of technology. They may not have a lot of internet access where they can hear and know about what's going on, or even radio. A lot of times they're not even doing things to really promote vaccinations, that type of thing. What would you do for the rural areas and the smaller communities?
Yeah, so I've been doing this for about over 40 years, and so when I come into a given city, a rural area or urban area, I sort of try to figure out where people gather. So in those rural areas, people are gathering and during the week someplace, right? I don't know what it might be. Maybe it's the rodeo, okay? Maybe it's like I just saw a sign. I was driving down on the street just coming here today, and I see my billboard that says Atlanta County Fair, October 1st to the 10th. I said, wow, I need to be at the county fair, right? Now, in those rural communities, they got the rodeos going on. They got the county fair. They got the county fair going on. Right. This is the fall time. This is when county fairs happen, is October and November. Right. That's right. So if for every rural area in America, there needs to be all the medical professionals in that community need to just come to the county fair and set that thing up there at the county fair. It's outdoors. It's the perfect place to do this. Right. So a big tent where everybody that comes to the county fair can get vaccinated. They're going to be there. That's great. That makes sense to me. They're going to be there. And guess what? If you get your vaccination, you get free admission to the county fair. I bet you they'd come.
That would be great. That's a great incentive.
Right. That's what you got to think out the box. We're not thinking out the box. We're not figuring out the ways in which to make it easy for people because they do gather. And you just got to figure out where they're gathering or what makes them get up, get dressed, brush their teeth, put their clothes on, get in their car and go someplace. People do that every day.
And see, that's great information because when we're thinking outside the box like that, what it does is it opens up ideas for other people to be able to say, hey, look, there is a way. There is a way. We have different information. We have the way to be able to do it. And so my next question is how do you get other medical professionals to line up with you to be able to get them to say, hey, look, we got to take care of things outside of our own community. Because if we don't look at things just out, if we look at things on the inside of our own community, our own bubble, yeah, those people might be taken care of. But again, we're talking about the greater good here. So how do we get other professionals to line up, be on one accord, so we can get this message out?
Yeah, so this is my struggle that I've had since I've been trying to do this now for 6 weeks, focused on COVID. Because my space is diabetes and cardiovascular disease, diabetes prevention and management. So I've been all things COVID for the last 6 to 8 weeks, and so this is my problem that I'm having here in my county. Is nobody's talking to each other. That's a real problem for me. So how come there needs to be one central clearinghouse where we talk to each other? All of us who are doing this thing are getting together and talking to each other every week. So now I saw this done in PG County. My operation is still in DC and Maryland. So I'm very in tune to what's happening in Prince George's County. Mostly black county. Every Monday, anybody and everybody that had to do with COVID on any level, testing for COVID, vaccinating for COVID, or a place where people gathered. So the unemployment departments were on there, the supermarkets were on there, any place where people went, they were on a Monday call. It was a stand-up call every Monday. There must have been 100 people on this call. It only lasted an hour. So it wasn't taking up a whole bunch of time, and they had a master calendar. So on that call, everybody would say, okay, well, this week we're doing this, and this week we're doing that. And so all of that would be gathered on that Monday call, and then that organization would put out this calendar for that week. And it would be up on the website, actually this was the health department of that county, would be posted on the health county's website. So if you needed to know what was going on COVID, it was up there. And so you knew every vaccination event, everything. We're not doing that here in Georgia. We're not doing that across the South because we have so many anti-vaxxers. But that would be what I would say we need to do immediately. So we're kind of getting there. We're moving. We've had a couple of calls now where I've been able to be on the call and the other people were on the call. And so now we're doing much better in talking to each other. But we still need to have someone who's going to step up and say, I'm the clearinghouse for this information. We're going to merge all the phone calls into one phone call.
Right.
Okay, and we're all going to be trying to push this rock up the hill together because we're not working as a collective to get to where we need to get to.
That's good. And now, one of the things that talk about, and we're still live. We're live with Dr. Coleman, and again, this is JS3 with Jehovah Jams Records. And so again, I started. She was interviewing me first, but I have so many questions for her, so I'm just going ahead and taking my time to interview her as we go forward. We all have our lane.
Right.
My lane, I asked God a couple years ago to allow me to do ministry 24/7. So between music and ministering at our church and the communities and hospice and hospital, that's what God has called me to do. So I praise God for that. Your lane, your ministry is being able to help people get well.
Right.
Okay? And so one of the big questions that I have is I'm so afraid concerned for our children.
Right.
And I'm so concerned about so many parents having questions about masking for their children and going to school and vaccinations, because they said before anybody 12 and younger could not be vaccinated, and so now they're wondering because there's so many younger people that's getting sick now, right?
Right.
Talk to our parents for a second.
Okay.
About how to go and to deal with this, because it's so much that, okay, my child is in school, my child needs to be out of school, you know, learning on Zoom or not learning on Zoom. How do we get the parents to really get on one accord so the parents can make a decision about being vaccinated? So not just that, but then what's going to happen with the 12 and under?
Right,
How is that going to work?
Exactly.
Because that's something, you know, as a chaplain, I can talk to the parents and say, listen, from a spiritual standpoint, this is what I feel. But I can't give them a definitive answer.
Right.
You as a medical professional, what do you say?
Okay, so this is really near and dear to my heart. Okay, so let's talk about the young kids, 11 and younger, and they're doing the research. In fact, they just had that whole study that came out this week, right, where Pfizer actually went down in age groups, and they were looking at the shot, and the reason why there's pushback from the FDA and and CDC is because you do not bring a medicine or a vaccination to the market for pediatrics, for kids, unless you are 100% sure what's going on, because they're still growing. They're not adults. So you want to make sure, and that whole growth process is very complicated, very complicated. So you want to make sure that what you're injecting into your children is not going to harm their growth or their vitality, or have any side effects that you weren't aware of. So they're taking their time, as they should. Sure. If I was a mom, and I had 2 kids. They're grown now, praise Jesus. I'm so glad. I don't have grandkids. If I was a parent of a child that was 11 and younger, I would make sure my child had on a mask. And I would also be asking my school, what's going on with your ventilation system? Are your janitors, when you're cleaning up this school, what kind of solutions are they using? Are they using the ones that are out there that are good for not just bacteria, but viruses? What's happening with hand sanitizer in the school? How are these kids keeping their hands clean? Are they out on the playground? Are you watching how that is working, making sure people are as distanced as possible, right? Are they in the cafeteria or out when they're outdoors eating lunch? Are they been told not to share food, right? Because that food has saliva on it, and they're taking a bite and then giving their, right? So we need to be thinking about all of this for our kids 11 to 5 because they can't get vaccinated. Understanding that most of those kids are not going to show symptoms. Most of those kids are probably carriers, which means that if I was a parent and that kid was my kid was coming back to my house and being around me, and I'm not wearing a mask at home, right? Then I need to know the COVID status of my child. So I need to be testing. So there is places that they're testing for free. And you need to be probably testing every other day or every third day, because you don't want, this is all about viral load. So if you can catch them as the virus is replicating and getting in higher concentrations in their body, and you can catch it within 48 and 72 hours, then even if they do have it, they don't have so much that you then have this inoculation of all this virus. And you can know that you got it in your house. So now, once I know it, hey, now we got to mask up, don't we? Now I have to take special precautions inside my home because I know I got a COVID person in my house. So that doesn't necessarily mean they have to be quarantined, but you need to increase your hand sanitizing, increase your masking, making sure you're wearing at least a 4-ply mask. This little cloth over your, you're bringing all these things, these big gaiters over your, that ain't a mask. What kind of mask is that? You need to be buying real masks, people. Okay, so you need to know if your home is COVID-free. And the only way to know that is you must test. So this is what I would do. Okay, now if you in the 12 to 18 range, you as far as I'm concerned, you need to be getting vaccinated. Those kids need to be getting vaccinated. Because we don't want, listen, this virtual education is a problem for our kids.
Absolutely.
They need, especially African American and Latino children. Let's talk about black and brown kids. Can we just talk about that for just a minute?
Let's be real.
African Americans, that's what I know about. And I'm just telling you that we have to survive with personal contact. We have to hug. We are huggers. We need to be right up on you. We need to be in your face. We need to feel you. Okay. Your children have that times 3. The fact that you're keeping them away from their friends, in your house, you're doing virtual learning. You are destroying these kids are being destroyed because of that. They have got to get back to school and be able to have personal contact. That is our tradition. That is in our DNA. This is who, if you've never been to Africa, you don't understand that. You must understand that. I've been to Africa. I've been to multiple countries in Africa. I've been to many of the Caribbean countries, which are from the part of my diaspora. We have to have that personal connection. And if we don't get it, our suicide rates go up, but also our sicknesses go up, especially mental health. Depression goes up. This lack of physical connection is killing us. So we have got to take this thing serious. Yes, question? Is there a question?
Yes. The news is reporting a decline in COVID among Georgia children.
Yes.
Will this impact parents' decision not to get the vaccination?
Yeah, so the reason why they're showing a decline in kids is because they're actually now testing. So they sort of got it at a certain point, and then now the numbers are coming down. But we're still nowhere close to where we need to be, which is no cases. How about 0, people? So let's think about this. If you're at 100 and now you're at 50, there's been a decrease, right? You went from 100 to 50. Right. But 50 is too many. Right? So when they say there's the decline, the question that should go through your mind is, where did we start? I need to know where we started. So when you tell me that, I need to know, first of all, where you're getting the data. It's from the Department of Public Health, right? Which is where I get my data from here in my county, right? Because I think that they give me good data. So I get it from them because they know what's going on the ground here. And then what I've shown in my county is these numbers are starting to go up because they're testing in schools now, and they weren't testing in schools before. So when you start testing, it's like, remember President Trump used to say, well, the reason why we see so many cases is because we're testing. Right. Well, yeah, that's correct. Okay, but we need to be testing because we need to know where we are so we can really see if things are truly coming down, right? Okay, so for these kids, I know for a fact that there have been outbreaks in schools, in counties in Georgia, where we're not being told about the outbreaks as parents. I know that for a fact because I know people who work in the schools. And they're telling me that before it was, if one child got infected, the whole school was notified of that one infection. Right. But now, and also they would say how many. So 10 kids today got COVID, right? But now they're not doing it, reporting it like that. They're saying COVID is now present in our school. We don't know how many of them kids actually did it. And wait, let me ask you a question. Did they go pick it up at the first period of the day, or did they pick it up at the end of the day? Was only one classroom affected, or did that kid go from class to class to class to class to class? Now it's the end of school, and he's infected every classroom he's been in. That's right. That's right. They're not telling us that. Okay, so that's a problem, unless the schools start testing every other day. So don't talk to me about your teachers get tested once a week. That's not enough, people. Because that means for 4 days out of the 5, they had COVID, and you didn't find out they had COVID until Friday.
Or if it's the weekend.
Exactly. So listen, either we're going to do this thing or we're not going to do this thing. If we're going to do this thing, we need to be testing every other day.
And that's my next question, because, my own personal belief is that, we really don't know how many people are infected.
No.
And so, my question is do you feel like the numbers of people that are infected or that have COVID are inflated, or some people say it's inflated, some people say we don't know what the true number is, because if you don't know what the true number is, then how do you know how to have a plan for it?
Yeah. I think my gut is, and I've been looking at this stuff since last year, my gut is the number of people infected is underreported. I think there are way more people with COVID than we're reporting. And the reason why I feel that way is because of the amount of people in hospitals that are sick. And then, usually that hospital number, and clinic number will give you a good feel. And there's a lot of people coming through emergency rooms, especially last year, that got sent home. They were symptomatic. Once you get to symptoms, this is why this whole take my temperature thing is so stupid. Because at the point in time where I now start to spike a temperature, I probably had COVID for 3, 4, 5 days. Okay, so why are you taking my temperature?
Right.
Because that means now I'm symptomatic, which means this virus has been in my body just growing and mutating and replicating to the point that my body now, my temperature spikes. You think about that. And parents, you guys know this. Your kid has got the snivels, they're sneezing and coughing, right? And then all of a sudden after you can tell they're not feeling well, right? Or they get the ear infection. Sometimes it takes 2 or 3 days before they spike. And now you feel them and they're hot. But you knew they weren't feeling well for a while before they actually spiked. That's the way the flu works. It's a virus. It has to get to a certain level before your body systems actually respond by spiking a temperature.
Right. I'll go back to what we talked about in the beginning about me being a chaplain, being at the hospital, or being in the hospice. And as I think about how, for instance, there was a police officer that worked for Georgia Tech. Unfortunately, he passed away, and I got a chance to minister to his family while I was there. The problem is, it's not just affecting, and when I'm talking about COVID, and I'm talking about the cases in the hospitals and everything, so many nurses that I've met are saying, I cannot do this anymore.
Oh yeah, no, they got PTSD.
So they're leaving the medical field to do something else.
Yeah.
Right? So
Yeah.
in these different situations, okay, it's affecting the patients, yeah. And it's affecting those family members, yes. Affecting those friends. But what happens to the nurses and the doctors and the things that they go through, and also taking it back to their families, right? So I had this one nurse, so I'm talking to her, and providing spiritual support, support for her. And she's saying, you know what? Over the last couple of days, I've had this amount of patients that have died. Not just cases of people that's coming to the hospital, but these people have died. And then she says, you know what? I cannot do this anymore. I am out of here. I'm like, I'm going to be here for a couple more weeks, and then I'm out of here. How do we protect? Because you can only have a certain amount of people that come out of medical school or come out of nursing school every year.
Right.
How do you protect these people from saying, I cannot do this?
I can't do, yeah. This is when we get to this is a personal decision. I can decide to not do this vaccine. You can't make me do it. And you were saying that that's certainly not Christian, because we need to be caring about and loving our neighbor. We need to be, as a population, concerned about these healthcare professionals, because you know what? It takes a lot to become a nurse. Years of study, sacrifice. Yes. It takes a lot to become a doctor, a respiratory therapist, a social worker. And so these people have devoted years of their life to get to a point where they are actually able to pass the exam to become the doctor, the nurse, the physical therapist, the phlebotomist, etc. If we lose our workforce, our healthcare workforce, as a country, we're going to be in big trouble, because there's years before one gets to that point. And if all of a sudden these people feel like they're in a war zone, these people are in a war zone. I know I'm old, so I know some of you old folks out there remember MASH. And those MASH doctors were having those casualties come in. That helicopter would come in and land, and they would be bringing these people on gurneys into that MASH tent for those surgeons to operate on them. And the trauma of that, right? That's what's happening in hospitals all over this country right now. They feel like they're in a MASH unit. Yes. They feel like they are in a war. They have, this nurse probably had been a nurse for 5-10 years. She has never had that many people die on her shift, ever. Maybe you might have, as an ICU nurse, maybe one person die on a shift. You haven't lost 10 people. You said the example earlier. So 20 beds, 18 of those folks were on ventilators, of the 20, okay? Once you get on a ventilator, your ability to come off that ventilator is very, very slim. Most of those people don't make it. They may be on a ventilator for 4 weeks, 6 weeks, 8 weeks, but that, your body is paralyzed so that this machine can breathe for you. You basically are in a death mode in terms of your body's functioning. Those people usually don't survive. And then so think about this nurse that's just losing people. I have ER doctors and cardiologists that work in ICUs and hospitals that are friends of mine. And so last year when this thing first hit, I was calling them all up, trying to get my arms around this thing. These doctors that work in these ICUs, these cardiologists, said they have never, listen, these people have been in practice for 15, 20 years. They said they have never seen anything like this COVID. These doctors, these ICU docs, these cardiologists says that once that virus gets into you, there's a whole cascade of metabolic events that happen so that all of a sudden you're throwing clots and your heart and your blood vessels are just, everything is going nuts. And that you can walk into this ICU on this day and 24, 48 hours later, you're gone. They said they'd never seen anything move that fast, ever. Now these are doctors that do this for a living. This COVID thing is serious. And so my thing is that if you know that to be true, and you're an adult parent, and you have kids that are young kids, or you have your teenagers, you need to protect your family. The Lord's expectation of you is you're there as their guardian. You have a special thing that you have to do. You're supposed to be the caretaker for these folks. You can't die. Who's going to take care of your kids when you're not here? You can't. You just say, oh, my mom will take care of them. Oh, my aunts and uncle will take care. Some of these kids are going to foster care. That's right. They don't have anybody to take care of them. That's right. So if you're going to bring these children into the world, you are responsible from 0 to 18. And you're responsible for making sure that they have what they need to be productive and to be successful.
Amen. That's so good. I'm here with Dr. Coleman, and so we have another question that's going to come up. But this conversation has been so important. We're talking about vaccinations. We're talking about COVID. And this thing is not just, again, it's not just something that's happening in one community. It's happening in communities all over the world. And we have to be prepared, people. And I was reluctant in the beginning myself, but after a while I was just like, this is something I had to do. I'm in the medical field. I'm a chaplain in the hospital. I'm a chaplain for a hospice. I'm in and out of churches. I'm in and out of people's homes and everything. It's something that I definitely had to do. And and I'm glad that I finally made the decision to go ahead and do it. Dr. Coleman has given us, she has a platform. She has information. We have people that that are on Facebook right now that are asking questions and everything. We have another question that's coming up here pretty soon. We need people to understand that this is something that's serious for our Black community, not just for the Black community, but for everybody. But we, a lot of times we're marginalized. We don't have the things that we need to be able to take care of ourselves and live and that type of thing. Dr. Coleman, myself, we want people to live. Right. We want people to be able to understand that there is help out there, there's information out here, and this is how we get the information out. And so that's the reason why we teamed up today to do this conversation over Facebook, over their page and everything, so we can get information out. We're in Clayton County right now, but this is for anybody that's in the world. So if you're anywhere in the world and you have a question right now, please chime in. What's the question right now we have, brother?
The question is, if I purchase items, food, anything through Instacart, Amazon, or something like this, is it necessary for me to immediately wipe it down before I put those items away? And can I get COVID from items that are being delivered from?
Yeah, no, I'm this seriously. So you guys are using, these various, platforms, right, to go shop for you. Okay, now you don't know who this person is shopping for you, right? And they're going to the grocery store. You don't know if they have a mask on. You don't know if they have gloves on. They're picking out this food, putting it in plastic bags, and then putting it on your front porch. So yeah, I would probably make sure that I wipe down everything before, when it comes in my house. I would, absolutely, because you don't know who's delivering this stuff to you. Now the question is can the virus live on hard surfaces or on food surfaces? For how long can it live? All right, they really haven't done any real good studies on that. Last year there were some preliminary studies where it said that thing could last on a heart like a stairway or a railing or whatever for an hour. Okay, so they haven't done any studies that I'm aware of with this Delta variant, right? That are really, well done studies. So yes, if you're not going to shop for yourself and you're having other people shop for you and you don't know their COVID status, now I tell you, these people, these platforms need to be making sure that everybody that's delivering their food to these people, they need to be vaccinated. So as we're starting to talk about mandates, and who should be vaccinated, I think those folks need to be vaccinated. Okay, I also think every healthcare professional needs to be vaccinated. I also think every teacher who is around children need to be vaccinated to protect themselves, but also to protect the children that they are responsible for. To whom much is given, much is expected. To whom much is given, much is expected. And so if you want to make a personal decision for yourself, but can you just go live in a cave someplace so you're not affecting nobody else? Because that's a problem, because we don't live by ourselves. We live in a world where we're surrounded by people. And so therefore we have to be cognizant of the fact that this is an airborne virus. It's not like, it's not like scabies where I have to touch it to get it, right? It's not like that.
Right. And that's one of the questions that I had, because initially, when you hear about what's going on, you say, okay, well, it's over in China. Well, how did they get to India? How did they get to rural Georgia? How did they get to Wyoming? It's like you say, it's airborne.
Airborne.
Right? So it's and when you think about how crazy it is to go all over spread all over the earth, it had to be something like that for it to happen.
Yeah.
Right?
Yeah.
So from your perspective right now, like, how do we? What's the next thing that we should be doing? Like, what's next? Because I'm talking about us, because we talked about doing a concert, with, in conjunction with the HOV Health records and what you're doing, and to bring people out into the community and through churches and that type of thing. What are we going to do next?
So this is what I'm trying to do, and I haven't had much luck. But anybody out there who wants to be a health warrior for my organization, I'm recruiting health warriors. And what these health warriors are going to do is, if I can, for everyone that I bring in here, and this is actually, we're going to be, there's going to be some gift cards and some compensation for people's times. I just need them to touch 20 people with my message. Right, so we're filming this. This is going to be up on my website. I have all of these YouTube videos that we've produced. If I could get everybody if this could go viral. See, cat videos go viral. Right, a little boy on a skateboard goes viral. Foolishness goes viral. Okay, folks cussing out each other goes viral. All sorts of stuff go viral. Can we just have some of my videos and I have PSAs right now. I am begging radio stations to play my PSAs. I shouldn't be begging. Every Radio 1 black station, urban station in this country should be, if you all know them, please call me up so I can give you my PSA so we can get this stuff on the radio. We're doing these onesie twosies. This needs to be a mass thing. And then, you know what? you influencers out there, the Nicki Minaj's, all right, all these people that have millions of followers, I need y'all to be playing my PSAs, to be putting out my videos, to come on my show, so that because you're an influencer. You people, these are your YouTube people. These are your Facebook folks. I don't have a following. Coleman, don't know who I am. But I need every influencer on Facebook, Instagram, and Twitter to come on my show to do what we just did today, where they blast it out to their people, right? Boost it, so that everybody can hear what we're talking about, so that as you're making your decision and doing your research, you have someone who knows what they're talking about telling you what to do. And you can go up to the website, you can read the information that I have up there. All of this is trusted sources.
Now, we have a lot of people out here that don't have your information, that don't have your website. Can you give every piece of social media, everything that you have out there, so people who don't know, who might be listening for the first time, so they can know how to get in contact?
Yeah, and just so you guys know, this is an amazing man. I just met him. See, the Lord is bringing all of these amazing people into my path. This is for your health. We do it every Saturday. This is part of my Healing Our Village COVID Conversations. This is for your health. It streams usually at 1 o'clock if I can find amazing guests like you to come here, because everybody can't come. My 800 number is 800-788-0941. Healing Our Village has been around for almost 30 years. My website is HOVHealth.com. If you go to HOV Health, all the icons, the Facebook, the Instagram, the Twitter, all that is on the website. You just hit it takes you to the pages, you like it, and then please spread it, all right? We're posting daily. Once you get on my Facebook page, it's called Healing Our Village Official. If you go to Google right now, Healing Our Village Official, it'll pop up. That's where we're streaming right now on my page. On HOV Health, I have something called live events. Every Saturday, we are streaming live events. I do my Sugar Busters Diabetes series on Mondays. We have a Zoom nutrition program completely free. On Wednesdays and Thursdays, we're doing Zumba and line dancing. All right? I'm trying to get the nation to be healthy. But on my website, YouTube, Healing Our Village, again, all of these COVID conversations that we've been doing since January are up there. I've got pharmacists, I have doctors, I have people from the Board of Health, we have video clips, we have all of these for your health that we've done, right? So again, it's Healing Our Village, HOVHealth.com. Total Lifestyle Change is my nonprofit. We're going to have information up there as well. I'm looking for health warriors that want to impact their community in a big way. So, I have a small grant. It's called Get Out the Vaccine. GOTV, Get Out the Vaccine. And we need to do that. And I'm looking for people to help me get out the vaccine in their communities.
Well, I'll tell you, so many people that's on the fence about it. Some people that, of course, we talk about non-vaxxers, and you have so many people that, have gotten vaccinated, but we need more. We definitely need more. And again, if this was something where it was just black people and they were just like, well, you got to get this, or you're gonna die, and that type of thing. Again, like we talked about with the Tuskegee incident, thing that happened many years ago, Tuskegee experiment. And if that was the case, then I could see why so many of us would be against it.
Right.
And we can understand that that there's times that people say, they're so against us. Why should we listen? But this is not that case right now. This is not that. This is something that's totally different. Now we're talking about from a medical perspective. We're talking about from a spiritual perspective. We're talking about both of them. And this is something that we really have to be on board with people, because if we don't want to see people die. Again, as a chaplain, as a pastor, I have seen people die. I've seen people die. To have somebody on a tablet watching your family member die is not fun. I've talked about this. I've written a song about it. That's on YouTube. That I've done a song about it called "So I Can Live." And to see these people die, again, family members grieving because their loved one has died on a Zoom call. It's not fun. To know that people have had, these long haul situations and having to say, well, you know what? my body is not working the way it was before COVID.
Yeah, it's
It's
not.
not working the
It's
same.
not the same.
I know my body. I know, I've had people that said that, they were an avid runner. They can't run anymore because they're out of breath all the time, right? Or people are tired. People are having these other situations that's going on with them and have no idea because they still don't have all the information. But if they would at least listen to this, then maybe the people would live, and maybe some of the people that's died that had these different things going on in their bodies, that they would say, okay, you know what, at least I can live through this. So we need to get the information out. We need more people to get vaccinated, and we need this that she's talking about. We need other people to join with her. We need churches to join. We talked about whether people should go to every segment in the country or every segment in the world are being affected. Hospitals, hospices, prisons. I'm a chaplain. I go to the prison. I do music, but at the same time, if I need to go to a prison to talk to them about vaccination, I'll do the same thing. I have a problem. Everything, truckers, everybody's been affected by this. And for us to get through all of this, we need to figure out a way. And this is one of those ways to get the information that's out there.
Yeah. Just, as a closing comment, I've been taking care of African Americans my whole career. My focus has always been on the African American population, and I went to Ghana in January of last year, and it was a profound change in my perspective. It was just, I just can't tell you how it just seeing that journey. Knowing how many people, I had no idea the millions of people that came through them slave trade years. I didn't know. I thought it was hundreds of thousands. It's millions. Okay, to see where they were kept in the dungeons and the point of no return, and just amazing. What struck me about a couple weeks ago is I was just thinking about African Americans and how resilient we are. The fact that if you've gone to the continent, you know that they have a real issue with all sorts of infectious diseases, right? Communicable diseases is what they call them. Where you've got these mosquitoes and the malaria and the Ebola and the Zika and the stuff. This is stuff just buzzing around in the air, right? But yet they survive. It just shows how resilient we are as a people. We went through slavery and yet we live. And so we cannot let this virus take us out because we're not thinking clearly about what we need to do to survive.
Amen. I hope y'all see Dr. Coleman's passion about this. Her passion for it. She said this is what all she's been doing for months now, is talking to people about vaccination, being vaccinated. Now, from, again, a medical perspective, from a spiritual perspective, and my closing thoughts of this. This vaccination, this COVID thing has no age, it has no color, it has no religious value of who can get it and who can't. And the thing is, we have older people that they said in the beginning it was older people, and then they're saying, well, the middle-aged people, but now we have the younger people and everything. People, we have to get it from all different perspectives and understand that this is vital, this is important, we have to do this now. We can't keep waiting.
Yeah.
And we have to understand that the longer we wait, the longer that people say, well, I'm on the fence and I need more information and everything, the longer it's going to take for us to get over this. Because everybody wants to get back to life.
Yes.
Get back to traveling.
Yes.
My wife has been wanting to take this certain trip to this certain country, this certain place for a long period of time, and I can't have her go right now because of everything that's going on. We want to go. We want to travel. Right?
Yes.
So if we do that, if we take care of each other and do these different things, we'll be in a better place, and we have to do this. So I praise God for everybody's attention today. Thank you, Dr. Coleman, for what she's doing. I just took over our interview, guys.
No, that's okay. I love it. And hey, listen, we've been talking for a long time. We're going to cut this up in as many pieces. We're going to put this up on our YouTube, on your YouTube. We're going to get this out. If this blessed anybody, please watch for the links and go up there. Send it to your family and friends. My number again is 800-788-0941. This is For Your Health COVID Conversations. We are based here in Jonesboro, Georgia at 177 North Main Street. If you want to help, you want to be part of the solution instead of part of the problem, I need an army of warriors to help us try to live long and prosperous lives. Thanks so much for tuning in today.